Hey guys, good morning. Good morning, everyone. Good morning, everyone. Good morning, guys. Good morning, people. Good morning, good morning, good morning, guys. Am I audible and visible to you all? Hello, everyone. Good morning, people. Good morning, guys. Good morning. Am I audible and visible to you all? How are you guys? Yeah. I started a little late. Sorry for that. Good morning, people. Good morning, good morning, good morning. How are you all, guys? What's up? What's going on? So kindly give me a thumbs up if I'm audible and visible to you all. Kindly give a thumbs up in the chat box if I'm audible and visible to you all. Very good, very good. Okay, it's fine. So let's start the topic. So I'm your teacher, Dr. Siddharth sir here. Okay. Yesterday I forgot to introduce my name. So Dr. Siddharth sir, my name is, and we will continue with the class. We have started with the topic. The topic is immunity. What is the topic name, guys? We started with immunity concept. Okay? We started with which concept, guys? Immunity concept. And this concept is present in Human Health and Disease chapter. Okay? Human Health and Disease chapter, it is present. And in that you can find the immunity concept. Now quickly let's define what is immunity. What is immunity, guys? Come on. What is immunity? Quickly revise. What is the meaning of immunity? What does immunity provides you? Quickly. We will just quickly go through what we have studied in the last class so that you recall quickly. So what is immunity? Immunity is the ability of our body to protect against all the type of foreign bodies, protecting from bacteria, virus, toxic substance which enter in the body is called as immunity. Study of immunity or study of the immune system. Study of the immune system will be called as immunology. Okay, so the study of immune system, the cells, the molecules, and the organs involved in building the immunity is called immunology. So last class we discussed immunity definition. We also discussed immunology definition, and then we started with types of immunity. Then we talked about types of immunity. So two types of immunity are there. Innate immunity, also known as natural immunity. Then we have acquired immunity, which is also known as adaptive immunity. Now tell me guys, exactly, which is the immunity present since birth? Which is the immunity present since birth? I am asking the question, which is the immunity present since birth? Since birth, which immunity is there, guys? Come on. So innate means since birth. Okay, innate means since birth. And one more question, guys, is innate immunity specific or non-specific? Come on, recall yesterday's class. Do we give a specific response or we give a non-specific response in innate immunity? Come on, what it is? Non-specific. Very good. It is non-specific immunity. Exactly. And as we grow, our body comes in contact with different foreign bodies. Our body interacts with different pathogens and develops the immunity, adapts to the different foreign bodies and gives a specific response. So when you obtain something, here you are obtaining immunity. When you obtain something, that is called as which immunity, guys? Acquired immunity or adaptive immunity, which can be also called as specific immunity. Which can be also called as specific immunity. Very, very important. Clear? So now one basic question, answer me. When you get polio vaccine, which kind of immunity you are developing? Are you developing acquired immunity or are you developing innate immunity? When you take polio vaccine, Which immunity you develop? Very good, guys. When we take a vaccine, like the polio vaccine contains the dead polio virus, your body is exposed to the dead polio virus. Your immune system is interacting with that virus, and now your body is obtaining a immunity against it, and that will be acquired or adaptive or specific. So the thing is that as we grow, our body comes in contact with different foreign bodies. As we grow, our body comes in contact with different foreign bodies. The body means here immune system. Your immune system interacts with different foreign bodies, right? And then your immune system adapts accordingly. Like in your gift classes, you may have seen many teachers, right? Different teachers for zoology, chemistry, physics, right? Mathematics as well. Basic mathematics class happened in the starting. So what has happened is, for every teacher's way of teaching, speaking, speed is quite different. So what you do, you have to adapt with every teacher's style, right? So here your body also, when it gets exposed to different kind of foreign bodies, your immune system is adapting. Your immune system always keeps on learning about new foreign bodies, how to give the response. So as we grow, we obtain, we acquire. As we grow, we obtain. Obtain means to acquire, and that is your acquired or adaptive immunity. Are we clear with this, guys? So with this point, we will go ahead. Now tell me, guys, very quickly, what is innate immunity providing you? What is innate immunity providing you? Come on. Innate immunity provides what? How many barriers are there? How many barriers are there in innate immunity? Quickly. Come on, come on. How many barriers? Yes, very good. 4 barriers. Tell me the barrier which prevents the entry of foreign body in the body. Tell me, answer. Which barrier prevents the entry of foreign bodies or microbes in your body? Which barrier? Name of the barrier. Physical barrier. Example of physical barrier: skin and mucous membrane. Very good, guys. Absolutely right. Come on. Next question. Next question. Which is the barrier which uses the different kind of cells, using your monocytes, macrophages, natural killer cells, neutrophil, which do phagocytosis of the microbes? That is which barrier? That will be which barrier? Very good, Ajay, Mithali, Shrikant, very good, guys. Exactly, cellular barrier. The barrier in which the WBC cells are involved, which are killing, phagocytosing the microbes. Those are the cellular barriers. Now, tell me the barrier in which the non-immune cells or the virus-infected cells will protect the non-infected cells by releasing a protein chemical called as cytokines, or one specific cytokine is given in your NCERT, that is interferons. So when specific chemicals are released or cytokines are released from the non-immune cells to protect the non-infected cells, that will be which barrier? That will be cytokine barrier. Absolutely right. Correct? And last barrier, the barrier which prevents the microbial growth. Which barrier prevents the microbial growth, guys? Which barrier prevents the multiplication? It doesn't allow the microbes to multiply in your body. That is which barrier, guys? Come on. Physiological barrier. Any examples of physiological barrier? The body function which is preventing the growth of the microbes in the body. What are the examples? What are the examples? Very good. HCl from stomach. Very good. HCl. Second, tears. Absolutely right. Saliva. Absolutely right. So I think you have revised very well, guys. So I think innate immunity is crystal clear. Okay. Now we will go ahead with acquired immunity. Okay. So very good answers, guys, with respect to innate immunity. Now we will move ahead with respect to acquired immunity. Which immunity, guys? Acquired immunity. Come on. Pay attention. Very simple concept, but you have to pay attention. If you don't pay attention, you will get confused. Okay? So let us talk about acquired immunity. So what is the basic meaning of acquired? Acquired word is coming from the English word acquire. And acquire means to obtain something. Acquire means what, guys? Acquire means to obtain something. Like right now you are sitting here and obtaining knowledge. You are acquiring. Yes? And you are acquiring specific knowledge. In physics class, you are acquiring specific topic of physics. In botany class, you are acquiring particular specific topic of botany, right? It is not just randomly going. So here also, when your body gets exposed, your immune system gets exposed to different pathogens. What are pathogens? Disease causing agents. I hope in the previous classes, pathogen word is clear to you all. Pathogen is disease causing agent. So when your body is exposed to different kind of pathogens, your body will fall sick for the first time. Your body will fall sick for the first time because for first time it has got exposed to that particular pathogen. And then you will fall sick for 7, 8 days, 9 days. Your body will slowly understand the pathogen. Your immune system will understand it. Your immune system will make some antibodies against it. And it will fight it. And after few days, that pathogen will be cleared from your body. Are you getting me, guys? So what is acquired immunity? Acquired immunity is, on other hand, pathogen specific. What it is? Pathogen specific. This word is very important, pathogen specific. Innate immunity was not pathogen specific. Innate immunity just has the 4 barriers. Any pathogen entering in the body of a child, the 4 barrier will help. Okay? But in acquired immunity, we have to give specific response to a pathogen. Okay? Every pathogen will be given a specific response. For that, the acquired immune system need to understand the pathogen. Okay? There are so many bacteria, so many viruses, so many protozoans. We have to understand, the immune system has to understand every pathogen specifically. Okay? And then after understanding it, it will memorize. Your immune system will keep a memory of it. It will be characterized by a memory. So listen to me very carefully. Okay? So if you fall sick with a disease for first time with a particular pathogen, okay, so there is, let's say, last class I told you yesterday, let's say we fall sick with chicken pox. Okay, like I remember the story when I got sick with chicken pox. So the first time, all that blisters comes on the body, fever, okay, malaise. Only good part was that you get holidays. Okay, you're not allowed to go to the school because it is a highly contagious disease. It will spread quickly to other people. So when I got sick with first time for the chicken pox, my body was very overwhelmed. My immune system was overwhelmed. What is this? What is this virus? Roughly for 7, 8 days, I was given bed rest. Chill, relax. For that 7, 8 days, I was having fever, body pain, not liking to eat anything. Okay, you can say not hungry, sometimes nauseatic. So my body was actually learning about that virus. And in 7, 8 days, my body understood the virus, prepared the antibodies and cleared the virus from my body. So the first response, the first immune response was very slow. The first immune response of your body is very slow to a pathogen which you see for the first time. But now, after this first interaction, my body has developed, my immune system has developed a memory against that pathogen. Okay, this is chicken pox. This is how it looks. When this comes, we have to make this antibody and clear this virus. Now, if after 1 year, 2 years, the same chicken pox virus enters in my body, now this time I will not fall sick. Because already my immune cells, there are some WBCs which have memory of that virus. Okay? The memory is there that this virus few years back attacked us. Now with that memory, we will quickly produce the antibodies. Without falling sick, the virus will be cleared from your body. So the second response will be very fast. The second response will be very fast without failing to remember it. Without failing to remember it. Like amnesia is a word. Amnesia is a word where the people tend to forget a lot of things. You might have seen that movie Gajini. He got an injury on the head and he forgets a lot of things. Amnesia. Amnesia is a word where it is loss of memory. But your immune system keeps the memory. So during the first interaction, you fall sick with the virus. But your body generates a memory, your immune system generates a memory, and when the second time the same virus comes in your body, the immune response will be very fast. Anamnestic response. What response? Anamnestic, without forgetting the virus. Quick response, and it is quickly removed from the body. You are not even coming to know, you are not falling sick also. Are you getting me, guys? So, sir, the memory cells can live as long as we live. Yes, Swaroop. The memory cells have 20 to 25 years of lifespan. So they are present in our body for a very longer time. Yeah, but not eternally, because as we grow old, at the old age, our memory cells are not working that fine. That's why old age people fall sick. So the memory property of the acquired immunity will be slowly lost. Are you getting me, guys? So read the second line, guys. Read the second line. This means that our body, when it encounters, means comes in contact with a pathogen for the first time, will produce a response called as primary response. Which response will be given? A primary response. Primary response, first response will be of low intensity, because we are seeing the pathogen for first time. We will recognize it, we will identify it. Our immune system will take some time to give the response. So the first primary immune response against the pathogen will be slow. But at that time, what will be generated? Memory will be generated. What will be generated? Memory will be generated. Am I clear, guys? Like right now you just heard some terrorist attack happened in the Kashmir area, right? Near the Pahalgam, some tourists were killed, right? You know that. Now the Indian army will properly have the memory. Where did the pathogen come from? So next time any event happened, the response will be more fast in that area. Because already the first response, it was little slow. The army reached very slowly at that place. But now, if any news come from that area, okay, some terrorists are coming there, the second response will be very fast. Same is your immune system. The first response against the pathogen is slower. But in the first response is slower, but we generate a memory. And with the help of that memory, when the same pathogen comes for the second time in the body, the response will be very fast. High intensity response, and you will not fall sick. Are we clear with this, guys? Are we clear with this? Are you getting me, guys? Are you getting this? Sir, I have a doubt related to the yesterday topic, that there is any chance that a non-infected cells getting infected even after having protection from the interferons. No, beta, if the interferon is released, then the non-infected cells will be protected. Where does memory is stored? Sinchan. Memory is stored in the WBC. There are special memory T lymphocytes and memory B lymphocytes. They will store the memory. Okay, so I hope these points are clear, guys. Acquired immunity is pathogen specific, plus it has a memory. There are memory cells. The first encounter with the pathogen will give a primary response which is of low intensity, but the second response will be very fast. Yes or no, guys? Like Like let's say you went to the college, you went to the medical college, okay? Now in medical college, little bit kuncham ragging also occurs. So some senior came, okay? And they talked very rudely to you. They were trying to bully you. And you are the fresh year, you are the first year class, you are going and standing. And now you are observing that why this senior is talking with very rudely with me, why he is bullying me, he's talking about my clothes and everything, nonsense and all. But now when you go home and analyze and you talk to your parents, okay, you talk to the seniors and other people, they guided you. Next time if someone does with you, you retaliate. You retaliate. So the first time when someone rags you or someone talks badly with you, you are little chill, you are little okay, understanding. You are giving a low response at first time. But second time if someone does, the same person does disrespecting you, your response will be more aggressive. Because you know, you have recognized that person, that this person is like this, like that only. Your response will be more stronger. Same is your immune system. First immune response will be very low intensity, but you will generate a memory. The second immune response will be very fast. So, are we clear with this, guys? Now we will move ahead with the topic. Okay, moving ahead. Subsequent encounter. Second encounter, the same pathogen enters the body for second time. First time chickenpox made you sick. You were, bed rest for 7-8 days. Malaise, fever, tiredness. But your body gave a low response, a low intensity response, and it generated a memory. Now the second time when chickenpox comes, already subsequent encounter, the second encounter, or the next encounter, second or the next encounter with the same pathogen will elicit means trigger a highly intensified, very strong secondary anamnestic response. Anamnestic is very important word. Anamnestic. Anamnestic. Amnestic word is coming from amnesia. Amnesia means loss of memory. Amnesia means what, guys? Amnesia here means loss of memory. But this is anamnestic, without loss of memory. Without loss of memory means your memory cells, memory T lymphocyte, memory B lymphocyte, they have stored the memory of the pathogen. Yeah, this guy came few months or year back in my body, troubled us. We fighted with them. But now we have a memory. We have to make this antibody quickly, make this antibody fire. So second response will be very quick. And the pathogen will be very quickly destroyed in your body. You will not fall sick. So here, what is this point telling us? This point is telling us that our acquired immunity has a memory. It has a memory against the pathogen. That's why the second response will be very fast and very highly intensified response. Are we clear with this, guys? This ascribes that our body, means immune system, have a memory of the first encounter. Our immune system has the memory of the first encounter. Are we clear with this, guys? Yes or no? Are we clear with this? Are we clear with this? Come on, guys. Give me thumbs up. Give me thumbs up. Quickly. Two properties we have understood actually. Two properties we have understood here. One property is specificity of the acquired immunity. Acquired immunity will give specific response. It will remember different pathogens. First response is low intensity. Second response is high intensity. Second response is high intensity. Am I clear, guys? So please explain the second point. Second point is telling that Your second response is very fast. Why? Because you have generated a memory of the first encounter. You have generated a memory of the first encounter when we first tackled the pathogen. Are we clear with this, guys? So specificity, sir, when will this class end? By 12:30 beta. Okay, shall we go ahead? Shall we go ahead, guys? Come on. Next, moving ahead. Now, how does acquired immunity helps you? How does acquired immunity helps you? Acquired immunity, see guys here. Tell me, in innate immunity and here in acquired immunity, where do you keep memory? Where do you keep the memory of the pathogen? Do you keep the memory of pathogen in acquired or innate? Come on. Where you keep the memory of the pathogen? Acquired or innate? Acquired. Very good. So here you have the memory of pathogen. Here there is no memory. Right? If acquired immunity has memory of the pathogen, it will give a specific response. What it will give? It will give a specific response. And here, since there is no memory in innate immunity, it will give you non-specific response. What it will give you, guys? Non-specific response. And now comes the point. Antibodies. In acquired immunity, your WBCs are producing antibodies. So acquired immunity does the production of antibodies. Antibodies are proteins against the pathogens. Against the pathogens. But here in innate immunity, no production of antibody. Here there will be no production of antibody. Are we clear? Very, very important. In acquired immunity, we are producing antibodies. Very important. Now, one basic question, guys. Can a single type of antibody will kill different type of pathogens? Can our body, the antibodies, will kill different types of pathogens? Or one antibody is specific to one pathogen? One antibody is specific to one pathogen, or one antibody can kill many pathogens? One antibody, one type of antibody is specific to one pathogen only. Am I clear? Right. So, since one type of antibody cannot kill different type of pathogens, that's why we are saying that in acquired immunity it is specific response. Specific response. Different type of antibodies for different type of pathogens. Are we clear? Different type of antibodies for different type of pathogens. Exactly. Right? Like when someone gets a dog bite, there is a dangerous chance that the person may get rabies. So what antibodies you give? What antibodies you give? You give antibodies injection to the patient of the dog bite against rabies virus. Against which virus? Rabies virus, na? But can same rabies antibodies can be given to a snake bite person? Can it be given to a snake bite person? No. In snake bite, the venom is different. The foreign body is different. So different antibody has to be given. Different antibody has to be given. So here, acquired immunity is pathogen specific. Pathogen specific responses are given. Are we clear with this? And now, When we talk about acquired immunity, there are two types of responses. One response will be given by cells, and that is called as cell-mediated immunity. In another one, we make the antibodies, and that will be called as antibody-mediated immunity. Antibody-mediated immunity. So in acquired immunity, we are having two types, where cells are giving the response, that is cell-mediated immunity. Where antibody is made against them, we call it as antibody-mediated immunity. And for cell-mediated immunity, what will be required? For cell-mediated immunity, we need the T lymphocytes. The T lymphocytes are responsible here, and for antibody-mediated immunity, here your B lymphocytes are required. Which lymphocytes are required, guys? B lymphocytes. Okay? So just remember, lymphocyte is a type of WBC. There are two types, T lymphocytes and B lymphocytes. T lymphocytes will be responsible for cell-mediated immunity. Antibody-mediated immunity will be done by B lymphocytes. So if I ask you a question, who will produce antibodies, T lymphocytes or B lymphocyte? What will be your answer? Who will produce antibodies, T lymphocytes or B lymphocytes? Come on in the chat box. Quickly, beta. Quickly. Very good. B lymphocytes. Absolutely right. So, cell-mediated immunity, T lymphocyte will help you. Antibody-mediated immunity, B lymphocyte will help you. And where is the antibody present? The antibody is present in your blood. And the antibody is present in your blood. Yes or no? Where is the antibody present? The antibody is present in your blood. Blood is a fluid. Blood is a fluid. And fluid can be also called as humor. And that's why it is also known as humoral immunity. Note down this word. Antibody immunity, mediated immunity can be also called as humoral immunity. Humor means body fluid. And blood is the fluid where your antibodies are present. So it is also known as humoral immunity. Are we clear with this, guys? Are we clear, guys? So cell-mediated and antibody-mediated immunity. Antibody-mediated immunity will give you antibody production, and cell-mediated immunity will help you via T lymphocytes. Are we clear with this? So going to the slides again, here, read. What we are talking first? We are talking about the primary and secondary immune response. Look here, the primary is the first response, and after primary, the next time when you interact with the pathogen, you give secondary immune response, are carried out with the help of two special type of lymphocytes present in our blood, B lymphocytes and T lymphocytes. Nobody asked me, can anyone tell me what is the full form of B and T? Why we are writing this B and T here? What is the meaning of this B and T? Come on. What is the meaning of this B? Why it is called as B and why this is called as a T? Isko kya bolenge? What is the meaning of this B and T word? Come on. What is the meaning of B and T? Beta nahi beta. Blood and tissue? No. No. B will be standing from bone marrow. The lymphocytes which mature in the bone marrow, they are the B lymphocytes. And the lymphocytes which mature in the thymus organ. In which organ? Thymus organ. They are the T lymphocytes. So below our chest, in the center, just below this central part of the chest, this is the sternum or the breastbone. Below this, there is a small gland, thymus. The lymphocytes which have developed in the thymus, they are called as T lymphocytes, and the lymphocytes which have developed and matured in the bone marrow, they are the B lymphocytes. B lymphocytes and T lymphocytes, they are brothers. They are helping each other, supporting each other, and fighting with the pathogen. So in acquired immunity, a question will come. Which are the main cells of acquired immunity? The main primary cells of the acquired immunity are lymphocytes. Which WBC? Lymphocyte. Okay? And the B lymphocytes develop in the bone marrow and the T lymphocyte develop in the thymus. And what do they do? B cell and T cell, they serve to protect. They serve to protect your body. Okay? They are the very important part of the acquired immune system. Are we clear with this, guys? Are we clear? Okay? Now, a small question I will ask you guys here. Let's see a question very quickly. एक question देख लेते हैं. Let's see one question, guys. One MCQ. We'll talk about one MCQ quickly. Let's see if we have the paper here. There is no paper here. ठीक है, anyways, we can ask on the screen. अच्छा, YouTube problem. No, class is not over, guys. One question before we end the class. Come on. One question before we end the class, guys. One question before we end the class, guys. Am I audible and visible, guys? One question before the class. Am I audible and visible? We are discussing one MCQ. A very important MCQ we are discussing. Come on. Read the question and tell me the answer. Tell me the answer, guys, for this question. Which of the following type of immunity is present at the time of birth and is a non-specific type of defense in human body? What is the answer? Come on. Cell-mediated, humoral, acquired, or innate? What it is? Come on, come on, come on, everyone. Yes, innate immunity. Option number 4, absolutely right, guys. Absolutely right. Super. Answer is innate immunity. And you might be thinking this is a very easy question. Very easy question, sir, asked. Okay, let me tell you something. Let me tell you something, guys. This question is question of NEET 2025. This question was asked in NEET 2025 question. 4th May paper question. This question came in NEET 2025. So very basic question. Okay, very important question, very important concept, immunity. Yes, it is easy peasy. I can change the question. If I ask you which is the antibody mediated immunity, then what you will mark on this? If I ask you which is the antibody mediated immunity will coming as humoral immunity provided by B lymphocytes. T lymphocyte will provide which immunity? T lymphocyte will provide which immunity? T lymphocytes will provide your cell-mediated immunity, right? So very important concept, guys, we understood today. That is the acquired immunity. So this is the basics which is needed for you for the innate and acquired type. In the next class, we will talk about the blood. Okay, we will talk about the components of blood plasma, RBC, WBC, platelets. We'll try to discuss the components of the blood. So that's all, guys. Thank you so much. So the chapter which you told is not in the NCERT. Human health and disease hath mein ka. Human health and disease in immunity part, you can see that. In immunity part, you can see that. So that's all, guys. Thank you so much. Take care. God bless you all. Chill. Bye-bye, everyone.